The last thing that anyone wants is to have to once again shut down our economies and suspend our lives to try and counter a massive second wave.
Well, with the number of coronavirus cases creeping back up across the country, millions of kids, mine included, are back in school. British Columbia has already started to scale back its economic reopening, shuttering nightclubs and banquet halls. Ontario is holding back on more reopenings as well. Are schools ready to take on the threat of a potential second wave? Meanwhile, the government is launching a review of its early pandemic alarm system after scientists say their warnings about COVID-19 were sidelined. Could the spread have been mitigated from the beginning if that early warning system was still in place? Let's get some answers from the Health Minister, Patty Hajdu. She joins us now from Toronto. Minister, hope you and the family are well. Great to have you back on the program. Let's start there. As the Globe and Mail first reported, your government sidelined the early warning system for the pandemic in 2018. It's called the Global Public Health Intelligence Network, which was supposed to give our country an early warning of the pandemic. You told me this week you hadn't even heard about this before the media reported on it. Who made the decision to sideline it?
So the decision to change the focus of the Health Information Network was made by the agency, and I can't speak to the individual that made that decision, but certainly it was an internal decision made to really refocus resources to domestic health concerns. And so, of course, much concern about that refocusing, and rightfully so. And that's why I've ordered this external review to understand what happened and what that information network needs to look like going forward.
But why was it refocused? Why did the scientists there say they were not being listened to? Like, what happened there? Because this was literally the system as our distant early warning for exactly this horrible situation, the pandemic. What happened?
Well, there were other ways that, of course, the Government of Canada gets information about outbreaks. As you know, we have through Minister Blair's portfolio information that comes forward from our international partners. Dr. Tam is on the World Health Advisory Special Committee. She understood about the outbreak in early December. That information was relayed to me by January 10th. We were all fully briefed up, and we knew we had a novel coronavirus on the scene globally. And really, I think we have to remain focused on the fact that this was supposed to be an additional source of information for the country in terms of some of those granular details. What does it look like at the ground level? My understanding of the information network was that it was analysts and scientists that would do some deep dives into, for example, cultural newspapers, regional newspapers, using social media and chat groups to really kind of get a sense or a pulse on what was happening on the ground. And yes, as you've heard and as I've heard, scientists were saying that they felt that they were hindered in their ability to do that work, and that this domestic focus really pulled them off work that was more international in nature. And that's what the review is meant to do, is to uncover how those decisions were made, and how we actually can build back to an information network that I believe is very, very valuable for the Government of Canada.
Well, if it's valuable and it's not redundant, and it may have affected how our country responded. Look, your government has been criticized for not shutting the borders quick enough, or making masks mandatory, or adhering too closely to the WHO. Do you think lives could have been saved, or Canada might have acted differently if those scientists who had that granular knowledge would have given you that knowledge, and Canada could have acted faster or differently?
Look, all along we have relied on our public health experts to guide us in the response. And as you know, as coronavirus has evolved around the world, our response has evolved too. As we've understood more about the virus and how it's transmitted and what risk factors exist, we've evolved with it. We've invested billions of dollars to provinces and territories to ensure that we have the most sophisticated testing and contact tracing system possible. I'm here in Toronto today to fund isolation housing for people who have been diagnosed with COVID-19 or are living in cramped quarters. All of that work continues, and our government will continue to respond with new information. We know that things will evolve because
my point is speed matters.
This is a brand new illness.
No, I get it, but your government said it all the time. Speed has to trump perfection. The whole purpose of the early warning system was speed, so you get speedier response. We didn't have the same response, for example, as New Zealand. Look, you told me that you didn't even know about this, but you're the minister, and there is the concept of ministerial responsibility. How consequential to Canada's response was the fact that this was sidelined and under your ministry? I mean, that's going to be a key accountability question for you.
Absolutely. And listen, that is exactly why the external review, because tools like this are important, and they should be used to their fullest capacity. In fact, I'm happy to report that the information network is now up and running and providing alerts to my department, to the Government of Canada. But we do need to understand why that decision was taken within the agency without any knowledge politically that it was being taken. And that's the reason why I've ordered this investigation, because it's very important for us to understand how these decisions are made and why whoever made that decision felt that it was not important enough to let the politician, the health minister at that time, know about that change in focus for that particular tool.
Right. All right, let me move to quarantine, because the Premier of Ontario, Doug Ford, said the quarantine system is broken, and he pointed the finger at the federal government, saying, look, there's 2.5 million people who have crossed the border since the pandemic. Police have found in Ontario 620 people have violated their quarantine. 87,000 people have been checked, so it's expensive. There's been 0 charges laid. There's been something like 42 tickets. He's saying it's broken and the federal government needs to change that. What is your response to that?
Well, I'll just remind Premier Ford that the OPP, in fact, all law enforcement have the full capacity to lay penalties as they see appropriate if people are violating the quarantine. Public Health Agency of Canada works really closely in partnership with the RCMP and other law enforcement agencies to make sure that if we're not able to contact people, we don't feel comfortable that they are in fact adhering to their quarantine, that these enforcement agencies are fully empowered to apply penalties. And it's very important that they do so if they feel that's warranted. Now, the flip side to this is that the infections that we're seeing in Ontario are not being spurred by international travel. In fact, we know they're largely coming from community spread. So it's very important that Canadians, in particular Ontarians, continue to practice the public health measures that will keep them safe.
Are schools safe? There's a big concern about the second wave. Cases are rising. I talked about that at the beginning with provinces like BC and Ontario. Are cases, Minister, rising now, and are schools prepared to keep kids safe?
Well, I know all provinces and territories are working on plans to make sure that they have a really good handle on how to protect kids and how to prevent outbreaks in schools. It varies from province to province, and of course with different medical officers of health there are different perspectives on how to do this. But I will tell you the extra $2 billion that we transferred to provinces and territories will go a long way in ensuring that they have the capacity to put into place plans that will protect young people. It's very important, though, that parents assure themselves by talking to their school boards, by talking to the teachers, by making sure they understand what the process is, and ultimately they have a role to play too. It's going to be a tough year for parents, because every time your child gets a sniffle, you really should keep that child at home. Every time your child has a sore throat, that child should stay at home, and that changes the landscape. I come from a generation where we went to school, we would have to be pretty much, passed out if we didn't go to school. And certainly my children remember that as well. But this year is going to be different. It's going to be very important that if our child is not feeling well, that we keep them out of school for that day. And that will go a long way to prevent, spread in schools.
All right, last question for you, Minister, and it has to do with Donald Trump. Donald Trump, there's a tape emerged from Bob Woodward and his new book, Rage, that Donald Trump actively admitted back in February he was downplaying the dangers of the virus. He knew it was deadly, he knew it was spreading, and he said, I'm downplaying it to avoid chaos. Did that impact the situation not only in the United States, but that's going to have an impact on Canada as well and how we handle the virus? Did that put more lives in danger, and has that impacted Canada, the U.S. response?
What public health officials have always said, and what public health theory says, is that people can't protect their health unless they know what the risks are. And so, you know what, from a very early stage in Canada, we were saying, wash your hands, make sure that you monitor your symptoms, make sure you check in with public health if you're feeling unwell. This is especially dangerous for vulnerable people in our communities. We know that the risk was low in early days, but the risk was high for specific populations. The more information that we had, then the more quickly we were able to get it out. So, for example, when it became clear that masks could actually reduce transmission, we talked about the wearing of non-medical masks in communities. So it's very important that as information and evidence evolves, and as we get that information as leaders, that we are transparent and honest with Canadians about what they can do to best protect themselves. That's how people can actually reduce infection, when they have those tools.
In other words, you don't buy the idea that you downplay it in order to avoid chaos. That strategy is not something you buy.
Well, I don't know if you recall this, Evan, but some months ago when I was telling people that they might be sick for a couple of weeks or have to stay home and take care of a sick person, then they should go out and get prepared for the eventuality that people might be stuck in their homes. I was accused of scaring everyone. So no, I believe that actually providing people with information that's credible, that's realistic, in a calm way, of course, and to tell people, look, these are the things that we're doing to prepare as a country. These are the kinds of things that we could anticipate if things got worse, is completely appropriate. And Canadian, we have to trust in Canadians. They need the information to make good decisions in their families, in their households, in their workplaces. And if they don't have that information, it makes it much more difficult for them to A, take it seriously, and B, prepare themselves for the potential that the virus could be spreading in their community.
All right, I got to leave it there. I appreciate your time. Health Minister Patty Hajdu, always good to have you on the program. I appreciate it.